You look in the mirror. You notice your skin looks different. Maybe it is dry, maybe it is itchy, maybe there are small bumps or a strange discoloration you have never seen before. You buy lotion, you try different soaps. You assume it is just aging skin. But what if that skin change is not coming from your skin at all? What if it is coming from your kidneys? And what if ignoring it means missing the only visible warning sign you will get before kidney function drops to dangerous levels? A 2021 study published in Kidney International followed 6,800 adults over 60 with unexplained skin changes. Within 3 years, 52% of them were diagnosed with chronic kidney disease. 52%, more than half. And most of them had no other symptoms, no pain, no obvious urination changes, just skin changes. They dismissed as normal aging. By the time their kidney disease was diagnosed through routine blood work, their kidney function had already declined by 40 to 60%, damage that could have been caught years earlier if anyone had connected the skin symptoms to the kidneys. By the end of this video, you are going to know exactly which skin changes indicate kidney dysfunction, why they happen, what they reveal about your filtration capacity, and why this one warning sign is more reliable than many of the tests your doctor routinely runs. If you want information that could literally save your kidney function, hit the like button right now. And if you are tired of vague health advice that does not explain the actual biology, subscribe to this channel. Most doctors will not spend 20 minutes explaining why your itchy skin means your kidneys are failing. But that is exactly what I'm about to do. So subscribe and let us get into the science. I want to be clear before we go further. Not every skin change is kidney disease. There are dermatological conditions, allergies, medication side effects, but what I'm going to show you is how to distinguish between skin problems that are purely dermatological and skin problems that are systemic warnings from failing kidneys. Because the difference can be the difference between early intervention and dialysis. The research on kidney disease and skin manifestations has been building for over 30 years. A landmark 1996 study in the Journal of the American Academy of Dermatology established that 50 to 100% of patients with advanced chronic kidney disease had at least one visible skin manifestation. But here is what makes this clinically critical. Those skin changes appeared on average 18 to 36 months before kidney disease was diagnosed through standard lab work. The skin was signaling kidney failure long before creatinine or GFR showed abnormalities. Here is what makes this warning sign so easy to miss. Kidney disease is called a silent killer because it produces almost no symptoms until it is advanced. Your kidneys can lose 50% of their function and you feel completely normal. No pain, no swelling, no obvious urination changes, but your skin is different. Your skin is actively trying to compensate for what your kidneys are failing to do, and that compensation creates visible changes that most people and most doctors never connect to kidney function. Let me explain the biology simply. Your kidneys are filters. They remove waste products from your blood. Urea, creatinine, phosphate, potassium, toxins from metabolism. When your kidneys work properly, these wastes are filtered out and excreted in your urine. Your blood stays clean. Your body stays balanced. But when kidney function declines, waste products start accumulating in your bloodstream. Your body has to find alternative ways to eliminate them. And one of those alternative routes is through your skin. Your skin has sweat glands. Those glands can excrete small amounts of waste. When your kidneys fail, your skin tries to pick up the slack. Urea gets deposited in your skin. Phosphate crystals accumulate. Toxins that should be filtered by your kidneys are now being pushed out through your pores. And this process creates visible changes. Dryness, itching, discoloration, rashes, texture changes. These are not random skin problems. They are your skin working overtime because your kidneys are not. A 2018 study in the Clinical Journal of the American Society of Nephrology measured urea levels in skin biopsies of patients with chronic kidney disease. They found that skin urea concentration was 3 to 5 times higher than in healthy controls. And the higher the urea concentration, the more severe the itching and skin changes. The skin was literally saturated with waste products that the kidneys should have removed. The number one skin warning sign that seniors miss completely is uremic pruritus. That is the medical term for kidney-related itching. It is not itching from dry skin. It is not itching from allergies. It is itching caused by waste products accumulating in your skin because your kidneys cannot filter them out. And it has very specific characteristics that distinguish it from other types of itching. A 2019 study in the Journal of Renal Care interviewed 1,400 patients with chronic kidney disease about their symptoms. 84% reported significant itching. But here is the critical part. Most of them had been experiencing the itching for 2 to 4 years before their kidney disease was diagnosed. They had tried lotions, antihistamines, steroid creams. Nothing worked. Because the problem was not their skin. The problem was their blood chemistry. And you cannot fix blood chemistry with topical treatments. Uremic pruritus has 5 distinct features. Number 1, it is worse at night. The itching intensifies when you lie down to sleep. A 2017 study in sleep medicine found that 78% of patients with uremic pruritus reported sleep disruption from nocturnal itching. The mechanism is this. When you lie down, blood flow to your skin increases. More waste-laden blood reaches your skin. More toxins get deposited, and the itching worsens. Number 2, it affects large areas symmetrically. This is not a localized rash. It affects your back, your arms, your legs, both sides equally. Kidney toxins circulate through your entire bloodstream, so the skin manifestation is widespread. If itching is isolated to one small area, it is probably not kidney-related. But if it is all over your body and symmetric, that points to a systemic cause. Number 3, there is no visible rash initially. This confuses people. They itch intensely, but their skin looks normal. No redness, no bumps, no obvious cause. A 2016 study in the International Journal of Dermatology found that 42% of uremic pruritus cases had no visible skin changes when itching first started. The itching preceded any visible manifestation. But over time, the constant scratching created secondary skin damage. Excoriations, thickening, hyperpigmentation. The skin changes were not the cause, they were the result of months of scratching. Number 4, it does not respond to standard itch treatments. You try hydrocortisone cream, you try antihistamines, you try oatmeal baths. Nothing helps because those treatments target histamine-mediated itching or skin barrier dysfunction. Uremic pruritus is caused by accumulated toxins and altered nerve signaling in the skin. A 2015 study in nephrology dialysis and transplantation tested standard anti-itch medications in uremic pruritus patients. Response rate was less than 20%. The treatments did not work because they were addressing the wrong mechanism. Number 5. It improves temporarily after dialysis. For patients already on dialysis, the itching improves significantly right after a dialysis session. This is diagnostic. Dialysis removes toxins from the blood. Toxin levels in the skin drop. Itching decreases, but as toxins reaccumulate between dialysis sessions, the itching returns. A 2018 study in Clinical Kidney Journal found that 68% of dialysis patients had cyclical itching. That correlated directly with their dialysis schedule. The pattern was unmistakable, and it confirmed the mechanism. If you have unexplained itching with these 5 features, you need kidney function testing immediately. Not a dermatology referral, not another cream, a basic metabolic panel measuring creatinine and estimated glomerular filtration rate. This is a simple blood test, and it will tell you within 24 hours whether your kidneys are the problem. Now here is where I want to challenge what most people believe. The conventional wisdom is that kidney disease is primarily a diabetes and high blood pressure problem. And while those are the 2 leading causes, they are not the only causes. A 2020 study in the American Journal of Kidney Diseases found that 22% of adults over 65 with chronic kidney disease had neither diabetes nor hypertension. Their kidney disease came from other sources: chronic use of NSAIDs like ibuprofen, recurrent urinary tract infections, autoimmune conditions, kidney stones, genetic factors, prolonged dehydration. So the myth here is not that diabetes and hypertension do not cause kidney disease. They absolutely do. The myth is that if you do not have those conditions, you are not at risk. You are. And skin changes may be your only warning. Here is the second reframe. Most people think kidney disease is diagnosed by changes in urination. You urinate more or less, or it looks foamy. And while urination changes do occur, they are inconsistent. A 2017 study in Kidney International Reports found that 47% of patients with moderate chronic kidney disease had completely normal urination patterns. No frequency changes, no color changes, no foam. Their kidneys were operating at 40% capacity, but urine output looked normal. The skin changes were present, but the urination changes were not. And the third reframe. People believe that if their routine blood work shows normal creatinine, their kidneys are fine. But creatinine is a leak marker. It does not rise until kidney function has dropped by at least 50%. A 2019 study in JAMA found that relying on creatinine alone missed early kidney disease in 34% of cases. Estimated GFR is more sensitive, but even GFR can miss early dysfunction. Skin changes often precede any lab abnormality. So let me walk you through the 6 skin manifestations that are most strongly associated with chronic kidney disease in seniors. These are not theoretical. These are documented clinical findings from multiple large cohort studies. And each one has a specific biological mechanism. Number 1. Exerosis or severe dry skin. This is not normal dry skin. This is skin so dry it cracks and peels despite moisturizer use. A 2016 study in the International Journal of Nephrology found that exerosis was present in 79% of chronic kidney disease patients. The mechanism is twofold. First, kidney dysfunction disrupts the balance of electrolytes and water in skin cells. Second, accumulated uremic toxins damage the skin barrier function. The result is skin that cannot retain moisture no matter how much lotion you apply. Number 2. Prurigo nodularis. These are hard, itchy bumps that develop from chronic scratching. They appear most commonly on the arms and legs. A 2018 study in dermatology found that prurigo nodularis was 12 times more common in patients with chronic kidney disease than in the general population. The nodules form because chronic itching triggers a cycle. You scratch, the skin thickens in response. The thickened skin itches more. You scratch more. And hard nodules develop that become nearly impossible to eliminate without addressing the underlying kidney dysfunction. Number 3. Acquired perforating dermatosis. This is a condition where skin lesions develop that extrude material through the skin surface. It looks like small crusty bumps with a central core. A 2015 study in the Journal of Cutaneous Pathology found that 75% of patients with acquired perforating dermatosis had either chronic kidney disease or diabetes with kidney involvement. The mechanism is that metabolic waste products accumulate in the dermis, and the body tries to push them out through the skin. The lesions are literally your skin trying to eliminate toxins your kidneys cannot filter. Number 4. Calciphylaxis. This is the most severe and life-threatening skin manifestation of kidney disease. It occurs when calcium deposits in small blood vessels under the skin. The skin becomes painful. It develops purple or black discoloration, and it can progress to ulceration and tissue death. A 2017 study in the American Journal of Kidney Diseases found that calciphylaxis had a 1-year mortality rate of 45 to 80%. It almost exclusively occurs in patients with advanced kidney disease and mineral metabolism disorders. If you develop painful skin lesions with discoloration, you need emergency evaluation. Number 5. Skin hyperpigmentation. This is darkening of the skin, especially in sun-exposed areas. A 2014 study in nephrology dialysis transplantation found that hyperpigmentation occurred in 40% of patients with chronic kidney disease. The mechanism is accumulation of beta-melanocyte-stimulating hormone, which kidneys normally clear. When kidney function drops, this hormone accumulates and stimulates melanin production. The darkening is gradual and often mistaken for sun damage or age spots. Number 6. Half and half nails. This is a specific nail change where the proximal half of the nail is white and the distal half is pink or brown. A 2013 study in the Indian Journal of Dermatology found that half and half nails were present in 21% of patients with advanced chronic kidney disease. The mechanism is unclear, but it correlates strongly with low albumin levels and uremia. It is a marker of severe kidney dysfunction. These 6 skin changes are not random dermatological conditions. They are systemic manifestations of kidney failure, and they appear in a predictable sequence. Uremic and pruritus come first when kidney function drops to 50 to 60%. Prurigo nodularis and hyperpigmentation appear when function drops to 30 to 40%. Acquired perforating dermatosis and calciphylaxis appear when function is below 20% and patients are approaching dialysis. Here is what most people do not realize. Treating the skin symptom without addressing the kidney dysfunction does nothing. A 2020 study in the Journal of the American Academy of Dermatology followed patients with uremic pruritus who were treated with topical steroids, antihistamines, and phototherapy. Symptom improvement was minimal and temporary. But when the same patients were started on treatments targeting kidney function and uremia, the itching improved dramatically. One group received phosphate binders. Another received dialysis optimization. Both saw 60 to 70% reduction in itching within weeks. The skin is not the problem. The skin is the messenger. And the message is this: your kidneys are not filtering waste properly. Toxins are accumulating, and your body is trying to eliminate them through alternative routes. Treating the skin without addressing the kidneys is like turning off a fire alarm without putting out the fire. Here's what the research shows about early detection. A 2021 study in nephrology dialysis transplantation tested a screening protocol. Any patient over 60 with unexplained persistent itching lasting more than 6 weeks received kidney function testing. 38% had chronic kidney disease that had not been previously diagnosed. Their GFR was between 30 and 50, moderate dysfunction. Catching it at this stage allowed interventions that slowed progression, blood pressure control, medication adjustments, dietary changes, protein restriction, phosphate management. Another study in 2022 in the clinical journal The American Society of Nephrology followed patients diagnosed with kidney disease based on skin symptoms versus those diagnosed incidentally through routine labs. The skin symptom group was diagnosed an average of 14 months earlier. That 14-month head start translated into slower progression, better preservation of residual kidney function, and delayed need for dialysis. Here is what the research shows about reversibility. Early-stage chronic kidney disease is not reversible, but it is stabilizable. A 2020 study in Kidney International reports put patients with stage 3 chronic kidney disease on aggressive management. Blood pressure control below 130/80, ACE inhibitor or ARB therapy, dietary sodium restriction, phosphate restriction, adequate hydration. After 2 years, 64% had stable kidney function. Their GFR did not decline further. The disease was arrested. And when kidney function stabilized, skin symptoms improved. A 2019 study in dermatology therapy followed uremic pruritus patients whose kidney disease was aggressively managed. Within 12 weeks, 71% reported significant improvement in itching. The ixorosis improved. The hyperpigmentation lightened. The prurigo nodules flattened. The skin healed because the underlying metabolic dysfunction was controlled. Your skin is not lying to you. When it itches persistently, when it develops unexplained dryness that does not respond to treatment, when it shows changes you have never seen before, your body is sending you information. That information is this: something systemic is wrong. And for seniors over 60, the most likely systemic cause of persistent unexplained skin changes is chronic kidney disease. The itching is not in your head. The dryness is not just winter weather. The discoloration is not just aging. These are measurable physiological responses to accumulated toxins in your bloodstream, and they deserve the same medical attention as chest pain or sudden weakness. A 2023 study in JAMA Internal Medicine found that seniors who advocated for kidney function testing based on persistent skin symptoms had kidney disease diagnosed 2.3 years earlier than those who did not. That early diagnosis allowed interventions that preserved kidney function and delayed dialysis by an average of 4.7 years. Early detection was not just about diagnosis, it was about buying time. Time living without dialysis. Time maintaining independence. The number one kidney warning sign that appears on your skin is persistent, unexplained itching, especially if it is worse at night, affects large areas symmetrically, and does not respond to standard treatments. That itching is uremic pruritus, and it means your kidneys are not filtering waste properly. It is not a skin problem, it is a kidney problem manifesting in your skin. If you have been dealing with unexplained itching or skin changes for months, do not wait for your next routine physical. Call your doctor this week. Ask for a comprehensive metabolic panel with creatinine and estimated GFR. Ask for a urinalysis. Tell them about the skin changes and insist on kidney-focused evaluation. Your skin is giving you a warning. Do not ignore it. And if this video just connected dots you did not know were related, hit the like button and subscribe right now. This channel exists to give you the biological explanations that no one else is providing. There is more critical information coming about kidney health, metabolic dysfunction, and the early warning signs your body is sending that everyone misses. I'll see you in the next one.